My name is Brian Sloan.
My name is Nate Traub.
And this presentation will be over restaurant ergonomics and injuries in the workplace.
We will be looking at workplace safety measures and other methods to prevent repetitive motion and musculoskeletal injuries.
With over $799 billion in sales in 2017, food service is one of the largest industries in the United States. There are over 1 million restaurant locations in this country alone, and over 14.7 million Americans employed by the food service industry. And these numbers are expected to continue to rise. Some of the most common tasks within the restaurant industry are cooking, cutting, lifting, reaching, and maintaining posture for extended periods of time. So it is no surprise that the most common injuries are cuts, burns, slips, trips, falls, and musculoskeletal disorders such as carpal tunnel syndrome, tendonitis, and lower back pain.
Musculoskeletal disorders, or MSDs, are distinct from other kinds of injuries because they develop gradually over time and are often a result of overexertion or a lack of fit between a worker and their job. The U.S. Department of Labor defines MSDs as an injury or disorder of the muscles, nerves, tendons, joints, cartilage, and spinal discs, which occurs as a result of exposure over time to various ergonomic hazards. According to the Bureau of Labor Statistics, MSDs accounted for 33% of all reported workplace-related injuries and illnesses in 2013.
There are numerous methods of MSD prevention, such as frequent breaks from prolonged posture, rotating activities whenever fatigue begins, avoiding extreme flexion and extension in the neck, wrist, and other joints, and minimizing reaching, twisting, and bending motions. Other ways to prevent MSDs include the use of protective equipment, administrative and work practice controls, and engineering controls.
Safety belts for the lower back reduce the amount of fatigue from standing. Padding for the elbows and knees reduce pain from direct contact with hard or sharp surfaces. Work gloves provide increased grip during lifting tasks. OSHA-compliant non-slip shoes reduce the risks of slips and falls, and shoe inserts reduce foot pain.
Work practice controls provide reasonable accommodations so that workers aren't expected to perform tasks beyond their physical capabilities, such as providing step ladders to minimize reaching tasks, assigning two workers to heavy lifting tasks to reduce exertion, and requiring break or task rotation. Administrative controls are education strategies that provide knowledge of ergonomic hazards to workers so they may take steps to prevent injury.
Engineering controls make direct physical changes to the workplace in order to minimize and sometimes eliminate hazards. Redesigning workspaces such that reaching and bending motions are minimized, reducing load sizes, and implementing ergonomic design and tools and utensils to promote neutral posture are all effective engineering control methods.
Musculoskeletal disorders cause thousands of injuries annually, costing billions of dollars across all industries each year. Workers are often unaware of the risk of developing MSDs, which can cause accidents, missed work, and increase turnover rates. MSDs often develop in areas of the back, neck, shoulders, hands, and other joints, and are usually very painful.
Back injuries are the most commonly occurring, resulting from prolonged bad posture, overexertion, and poor technique while bending or lifting. Cooks and cashiers are considered high-risk occupations for developing back injuries, as their tasks involve standing for long periods of time, performing frequent upper body motion, reaching, bending, and other repetitive motion. As a result, many workplaces have chosen to implement education-based injury prevention strategies in order to reduce factors such as injury rates, lost productivity, healthcare costs, costs of replacing injured employees, and worker compensation.
In conclusion, musculoskeletal disorders and other ergonomic injuries, while common, can be prevented with effective implementation of ergonomic principles. Protective equipment, along with the use of administrative practices, work practice, and engineering controls, can greatly reduce the risk of injury by ergonomic hazards and the risk of developing MSDs. Thanks for listening, and as always, remember to like and subscribe for more fun information.